When most people hear the word plague, they think of the Middle Ages. They picture crowded towns with no sanitation, ships carrying rats, and doctors wearing long bird-shaped masks stuffed with herbs. The plague is remembered as the Black Death, a pandemic that killed millions across Europe. But plague is not just history. It is still present in our world today, and this week it was confirmed in California. A resident of South Lake Tahoe has tested positive for bubonic plague. Health officials believe the individual was bitten by an infected flea while on a camping trip. Fortunately, they are now recovering under medical supervision. This is the first confirmed case in El Dorado County since 2020. Yet local surveillance has already shown that rodents in the Sierra Nevada carry plague bacteria. The environment itself is a natural home for this ancient disease. Globally, between 1 and 3,000 cases of plague are reported each year. Most occur in countries such as Madagascar, where outbreaks can involve thousands of people. In the Western world, however, cases are rare but consistent. In the United States, an average of 7 people contract plague annually, mostly in the West and Southwest. Arizona, New Mexico, Colorado, California, and Oregon are the states most affected. Rodents like ground squirrels and prairie dogs act as reservoirs, and fleas carry the bacteria to new hosts. When humans or pets come into contact with these fleas, infection can occur. The recent case in California was bubonic plague, the most common form. It typically begins with sudden fever, weakness, and swollen lymph nodes known as buboes. But plague can also appear as septicemic plague, which spreads in the blood, or pneumonic plague, which infects the lungs. These forms are more dangerous, especially pneumonic plague, which can spread person to person. In July 2025, Arizona reported a fatal case of pneumonic plague in Coconino County. This was the first pneumonic case in the region in many years, and it demonstrated how serious the disease can be when it is not diagnosed quickly. Back in 2015, Utah also reported a fatal case, reminding us that plague remains part of the American landscape. Now, how worried should we be about plague today? The good news is that plague is treatable. With antibiotics such as doxycycline or gentamicin, most patients recover fully if treatment begins early. This is why the California patient is expected to recover without long-term problems. Data from the Centers for Disease Control and Prevention shows that US plague cases between 2000 and 2020 had a fatality rate of around 11%. That number is high compared to many modern diseases, but far lower than the almost certain death faced by plague victims in the Middle Ages. The difference is antibiotics, rapid diagnosis, and strong public health systems. Plague also teaches us about the environment, the bacteria. Yersinia pestis has survived for centuries because it hides in rodent populations. When climate conditions support flea activity, the risk to humans increases. Warmer, wetter seasons can boost flea populations, which is why outbreaks often follow environmental changes. Pets also play a role. Cats are highly susceptible to plague and can transmit it to humans. This is why health advice in areas like Arizona and California includes keeping cats indoors and using flea prevention for pets. Dogs are less likely to suffer severe illness but can still carry fleas into the home. In the Western world today, plague does not threaten society the way it once did. But it remains a powerful reminder of how old diseases can persist and reappear. The California case shows that even in developed countries, public health must remain alert. As we close, think about the contrast. In the 14th century, plague reshaped Europe and killed millions. In the 21st century, the same bacterium causes only a handful of cases in the United States each year. This is not just luck, it is the result of science, medicine, and the systems we've built to protect communities. At Unicate College, we are committed to sharing this kind of knowledge and helping people see the connections between past and present. If you want to be part of that learning journey, join us and explore our courses in health, science, and education. Thank you for listening to Unicate Talks. Stay curious, stay informed, and remember that even the oldest diseases can still teach us something new about our modern world.